so he's part of our family. And so, oh no, yes, it was a journey, that one. My own personal experience of mouth cancer as a clinician goes from one of my close friends. He phoned me with a toothache. Now, mouth cancer can present in a really strange way. And we'll call this guy John because it's not his real name. So John phoned me one night with raging toothache. And I've known John for years. I was his dentist. I knew he had no holes in his mouth. So he came to see me at 8 o'clock at night. Your friends are allowed that because you've got your mobile phone number and they don't want to come in working hours. So he popped in and he was in pieces. He really was in a lot of pain. I could see nothing wrong. So I did the usual thing. Let's eliminate the obvious. So we took x-rays, there was nothing there. We tapped the teeth, and I found one tooth that was jumping. We adjusted his bite because it was slightly high in the bites and said, look, come back, give me a bell, come back later on. 2 days later, he's there in pieces again, absolutely in pieces. And I'm not a dentist who leaves things, who's, oh, we'll just review it. Because if you come to me as a patient, you're in pieces. You're having a lot of pain, and it's really important to think, like, let's deal with this. So we took the nerve out. And I don't take nerves out of teeth for no reason. We numbed him up first, and he said the pain's gone. So it's one of those things we use as a last diagnostic tool. If I can numb you up, then it's likely to affect that tooth. So if it walks like a duck, quacks like a duck, 9 times out of 10. So we removed the nerves from this tooth. And I phoned him up in the morning and said, how's it going? He said, oh, it's gone. I've slept overnight. It's been brilliant. Absolutely fantastic. Anyway, I got a phone call from his flatmate about 2 weeks later saying, John is in pieces. Could you pop round to his flat? Because I'm a little worried about him. He's losing weight. And I popped round and thought, this guy is a big lad. He's a bodybuilder. We all know. Just if I said he'd lost a stone in 2 weeks for no real reason, so my alarms went off. And he said he's been to his doctors, he's been to everyone, and no one can find out. So I knew there was something. You have this sixth sense. You have a tingle that comes down the back of you. You think there's something wrong there. There was nothing there. So I phoned him up. I phoned the maxillofacial on-call dentist because I can. That's my journey. I know. One of my businesses, we ran the out of hours for Merseyside and Cheshire. So I knew the journeys to go through. Anyway, I admitted him. Because nothing was working. Local anaesthetic wasn't working. There was just nothing working whatsoever. They managed to sedate him, gave in diazepam. John died 3 months later from mouth cancer. And this was from a mouth cancer, not normal. It presented. It was a mouth cancer pressing on his trigeminal, his facial nerve, which maxillofacial nerve, which supplied the tooth, which was giving him toothache. He had cancer all the way through him. It was a horrible presentation. And it was one of the reasons I volunteered to work a lot with the Oral Health Foundation, because I feel that as part of my job, I couldn't have done anything more. And I think as a dental professional, knowing you couldn't do any more is really, really important. He's a close friend, and I celebrate the fact that his life put me on the pathway to be really understanding my patients' journeys, understanding that if someone phones me up and they're in pain, they're in pain. They're not just going to be fobbed off with antibiotics. Because the patient journey is absolutely critical to feel that they've got support. So we worked on all our patients' information leaflets. I knew where smoking cessation was for my patients. We had a system that supported my clinicians to be better preventative clinicians in the world of cancer, and to know the local cancer specialist. So it's really important for your patients to have access to you when you might not feel it is really worth seeing. So to celebrate cancer and the journey, it can be really emotive and emotional for you and your team when you get things right. You know you have supported your patients all the way through. You know you have had those patients who phoned you up with a small ulcer and you've gone, right, no problems, give them a diary. I'm having a nightmare of a day, but I don't know when I'm going to fit them. But you one look, 2 seconds, yeah, that's fine. Off you go. So really encourage your patients to go and see the dentist. And if you're a patient, phone your dental practice and keep pushing till you've made sure that lump or bump isn't something exciting.